The decision on how to feed your baby is going to be quite a major one for you. You may have already decided before you got pregnant how you want to feed your baby. 75% of women will have made that decision before they even think about having a baby. Social influence will have a really big impact on your decision on how you want to feed your baby. Most women will tell midwives when they're asked that they're going to try to breastfeed, even if they don't want to. But it's a decision you should make once you've got the right information about different ways of feeding. It's got to be the right one for you and work for your lifestyle, and you should feel no pressure to feed one way or the other. For breastfeeding to work, you have to want to do it. It's not the easiest way to feed your baby in the first 10 days. It's quite difficult coming to terms with how it works, and the baby also is a learner and has to work on how this feeding thing happens. Most mammals don't have lessons on how to latch on and breastfeed. They seem to have a very instinctive feel of how that will work. To a great extent, that's exactly the same with human babies. We know, though, that some mammals' babies don't live because they don't learn to latch on properly and they don't get enough nutrition, and that's why we give advice to women and help them to learn how to breastfeed. If you grew up surrounded by family members that did breastfeed their children, aunts, sisters, your own mother with younger siblings, and you've grown up seeing breastfeeding as a very normal part of your culture, you're much more likely to have very positive feelings about it, because you'll have stored away many years of little tips in your brain that you didn't even know that you had. If you didn't have that experience, you'll be a complete beginner and feel much less confident that it'll work. It really will work, but you need good advice and encouragement when you're learning. So if you're going to breastfeed, you need to get really good, consistent advice on how to help yourself do that. And most importantly, you need to get help when you are breastfeeding. You need help in hospital, you need help at home after you've had your baby, and you need ongoing support when you get home. That is the single biggest factor in getting you to successfully breastfeed your baby. If you have family members living near you or with you that have breastfed, then you have a good chance of feeding without problems. If you haven't, and lots of women haven't, then you'll need to get some really good help from different sources. You need a midwife or a breastfeeding expert that's going to give you the same consistent help and will be there for you when you need them, usually only for the first 2 or 3 weeks. After that, you'll be well on the way to successfully feeding your baby by yourself and feel comfortable with it. Similarly, if you're planning to formula feed your baby, you still need to know how that works. It's much simpler in terms of how to do it. The instructions are written on the back of most baby milk packages and it's very straightforward. But you do need some tips on how to feed your baby correctly. There's also a growing issue with formula feeding of babies being lactose intolerant or allergic to formula. This is happening to more and more babies, and babies are being fed with a dairy-free formula. That's one thing that may influence your decision making on how you're going to feed your baby, as he or she is very unlikely to be allergic to your breast milk. It's a living, changing substance that is perfectly designed for your baby by your body. So you're very unlikely to have the digestive problems of colic, wind, sickness and reflux that formula-fed babies commonly suffer from. On the other hand, the advantages of formula feeding are tempting for many women. They feel they have much more control over how much their baby is having and how often their baby's feeding, and they feel that with the accumulation of bottles and cartons of milk and sterilisers and all the equipment that they can buy, it gives them a much more secure feeling of having control over their baby's nutrition. One doesn't really need that control, as the very fact that the baby is contented, is gaining weight and is having lots of dirty and wet nappies is proof enough of growth and good feeding. But for some mothers, those facts are not enough and they need to control and monitor feeding in more visible ways. Some women will be returning to work quite soon after the baby's born, and this will affect their decision making. But whichever you choose, getting the right advice in the first place will help you to get it right for your baby.